anchor down just onto the bony prominence below that. That's your coronary ligaments. That's also your tibial plateau. Okay? MCL will come from the medial epicondyle of the femur to the medial condyle of the tibia. Between these 2 points, you can feel it transversely just there. And if you just come round, Gary, we will show the LCL, or lateral collateral ligament of the knee. Comes from the lateral epicondyle of the femur into the fibular head, which is just there. Again, we're going to palpate it transversely, just there. Okay, Pat, any more?
That's it, rec fem now.
We're on to the muscles now, okay. So rec fem comes from the AIIS. So this is the ASIS, 2 finger breadths down. We're into the AIIS. It's quite a central muscle, runs down the front into the base of the patella and then into the tibial tuberosity via the patella tendon. It's a kicking muscle. Its action is to flex the hip and extend the knee. Okay? So if you want to palpate that, we can move down centrally to the quads, and that's it into the base of the patella. If we want to resist it, I'm going to ask you to lift your hip towards your stomach and kick out at the same time. That's the action of rec fem. Okay? Next is sartorius. Sartorius comes from the ASIS, so it's slightly higher up. It runs down and then towards the medial aspect of the tibia. Its action is to flex the hip and also flex the knee. So if I get you to bring your leg towards yourself and heel towards your bum, that's it. Okay? Iliopsoas is a hip flexor. It's quite deep. In this position, just off your ASIS, I'm going to get you to bring your leg towards yourself and relax. And again, and you feel that tendon pop in towards your hand. Okay, that's comprised of psoas and iliacus, otherwise known as iliopsoas together. Okay.
Glute max.
Glute max. Just flip onto your front of me. Glute max is a big muscle at the back. I'm just going to ask Jim to extend his leg. And we see glute max contract underneath my hand. Okay. Glute medius. Easy way to palpate glute medius. If you find the greater trochanter, if you come from the greater trochanter about a 45-degree angle up, you're in the glute medius. That's generally a little bit sensitive on people. How's that, Jim? Okay, a little bit tender. Okay, that's your glute med. So find your greater trochanter. If you imagine a 45-degree angle coming off that, you're into glute med. Alright. What's next?
Biceps femoris tendon.
Biceps femoris. Okay, so you've got 3 hamstrings. They're all coming from the ischial tuberosity, which we said was up high. One will come laterally, which is your biceps femoris. 2 will come medially, which are semimembranosus and semitendinosus. The most medial will be semimembranosus. After that, you'll have semitendinosus, and then going laterally, you will have biceps femoris. So if I get you, Gemma, to bring your heel towards your bum, lift, hard as you can. And now we can see biceps femoris. I don't know if you can see that there, guy. That's biceps femoris there laterally. Semi-ten, semi-mem. Okay? Did you get that? Alright. TFL, okay. I'm going to get you if you face so TFL comes from the ASS, just onto your side. If you find the ASIS, TFL attaches into the ITB, the iliotibial band. TFL, sorry, is tensor fasciae lateral, okay? It attaches into the ITB, which is iliotibial band. The iliotibial band crosses over the greater trochanter. So if you find your greater trochanter, find your ASIS, in between the 2 points, you'll be able to feel your TFL. If I get you then to abduct, it'll pop into your finger. Okay? Relax. Hang on. Very good.
Adductor, magnus, longus, and brevis.
Okay, so onto your side. The adductors, sorry, measure on the back. That's it, right back. Best way to think of the adductors, you would have 3, okay, and they're working towards. So if you want to feel, always think of them in alphabetical order. So you've got adductor brevis, longus, magnus. B is up highest, takes the first third, L takes the second third, Magnus takes the bottom third, okay? They all adduct, so to resist adduction, this is all adductor magnus, brevis, longus working, okay? Brevis will be quite high up. Longus will take the second third of the upper thigh. Magnus, take the bottom third. You then have gracilis, which is a long muscle, runs down, and it's the only one to cross the knee joint, okay? Again, it's an adductor. Okay. Periforms. So flip onto your front against me. Periforms is quite an important muscle. We talked before about nerves that, the sciatic nerve either runs in front, behind, or sometimes in individuals through the piriformis muscle. Okay, so it's quite important to be able to palpate. Best way to do it, find your greater trochanter. It's then going to run almost directly back towards the front of the sacrum. It sits quite deep, so you have to press in quite deep to get it, and it is quite sensitive. How's that feeling?
Very, very sensitive.
Okay, very sensitive. Okay.
Fastest lateralis and medial.
Okay, Jim, just sit on the edge, mate. So I'm going to get you to resist out. Okay, so we can see this is his VMO muscle here. His rec fem will be straight up. His vastus lateralis will be this muscle here. Okay, that's not too hard, is it? Sorry, just to say as well, there's an intermedius muscle, vastus intermedius, sits underneath your rec fem as well. Okay. Gastroc. So flip over. Gastroc attaches above the knee joint into the femoral condyles. This would be your medial, that's your lateral head, okay? It's what people perceive as their calf muscle, okay? So it's this big chunky muscle attaches then into the calcaneal tuberosity. What it does is, it plantar flexes. So if you push into my leg now, this is the gastroc working. Soleus sits underneath the gastroc and it attaches below the knee joint. If you want to isolate soleus, what we can do is lift up the knee, bend the knee, so we take gastroc out of the equation. I then get you to plantar flex for me, gentlemen, and I'm getting soleus primarily to contract in that position. Okay? What's next?
Tibialis anterior.
Okay. And flip over. So tibialis anterior. It's a dorsiflexor coming from the front of the lower limb. If I get you to dorsiflex for me, we can see this muscle contract up here. Okay. Extensor hallucis longus is obviously the clues in the name. Extends the big toe. You can see this pop up just along here. And you also have extensor digitorum. So relax the big toe for me. Just the smaller toes. That's it. And we can see that pop up here. Okay. Have you seen that?
Perineals, longus, and brevis.
Okay, the perineals are everters, so they're going to be on the lateral side. Perineals longus comes from the top of the fibula, basically talking the upper 2/3 roughly. Attaches in underneath the base of the first metatarsal. If I get you, relax Jim, relax. If I get you to push out, okay, and relax again, we can feel that muscle contract again. Okay, Perineals brevis does the same thing, it just attaches lower in, evert again, and that's it. Okay, we should probably do the muscles on the inside as well. So you have your Tom, Dick and Harry muscles, that's your tibialis posterior, flexor hallucis longus and flexor digitorum. A bit more of a subtle palpation with these. Tibialis posterior is the one closest to the medial malleolus. Then you have flexor digitorum and then flexor hallucis. Okay. The way to isolate tib post is to get the person to invert. So invert, relax, do it a few times, you'll feel a tendon pop into your hand, and relax. And again, good. I want you then to curl in your toes for me. So this is then flexor digitorum a few times for me, Jimmy. Again, okay. And lastly, flexor hallucis, in, out. Okay, very good.
Tibial nerve.
Tibial nerve, okay, so flip onto your stomach for me. Actually, we might just run through the nerve pathways. Just stand up for me.